small saphenous vein. It arises from lateral malleolus, and it also travels within two layers of fascia and between two heads of gastrocnemius muscle. And at the savino-popliteal junction, it can be some variation. Most of the people, the SSB will join the popliteal vein, but some people, their SSB have no connection with popliteal vein. And once it goes into popliteal vein, there's gonna be another thigh extension here, going further up at the posterior thigh. And it has another name, the Giacomini vein. Eventually, the Giacomini vein will join the great saphenous vein at the upper thigh level. So we have, we give it another vein, another name, which is intersaphenous vein.
Hello, everyone. Is my screen on?
Yes, please.
Yes, thank you. Thank you. I hope you all had a great weekend. I'm Donald Liu, and I would first like to thank the moderator, Dr. Chang, for inviting me to this talk, and also thanks SciAsia for providing such a great platform for us to hold this academic webinar. And again, my talk today will be about the cutaneous finding in patients with chronic venous insufficiency. And before we start, a bit about myself. I studied medicine in Medical University of Southern Africa in South Africa and did my PhD in Edinburgh, UK. Ended up in Taiwan to complete my dermatology training, and I'm now practicing in Taipei Medical University Shuang Hospital. And I have no conflict of interest to declare, so let's start. And by definition, chronic venous insufficiency is a term that describes the presence of venous hypertension from shear stress and reflux of the incompetent valves in the superficial, deep, and/or the perforating veins.
Can everyone see my screen?
Yeah.
Okay. Perfect. Well, thank you. It's an absolute honor to present on this topic. I think we all know that 10 minutes is not enough to discuss this topic in detail, but I will try my very best to at least cover the fundamentals. I have no disclosures for this topic. So let me start by sharing some numbers with you. This is a survey from 2019 from ASDS. Dermatologists in the US perform about 4.1 million cases of laser treatments, 2.3 million cases of neuromodulators, and so on and so forth, until you get down to the very bottom of the list. Sclerotherapy is a measly 130,000 cases that year. And surely this is not because of the lack of need. I feel this is an underappreciated and undertreated problem. About 40% of women and 15% of men in the US complain about leg veins. So why don't we do more sclerotherapy?
Good evening, everybody. My name is Chong TT from Singapore General Hospital. I'm very delighted to be invited to be part of your important CY Asia event. Thank you to the moderators and chairman for inviting me. Special thanks to SL Chong, who I met in Taipei. My topic is how to start endovenous treatment for varicose veins. A little bit about myself. I graduated from Australia, did my training in the US, general surgery at Johns Hopkins and vascular surgery in Boston. I spent a total of 18 years overseas before returning to Singapore about 10 years ago now. And I'm currently head of vascular surgery at Singapore General Hospital. This is the outline of my presentation. We'll talk about an overview of venous disease, some minimally invasive venous ablation treatment options, as well as clinical studies on the radiofrequency ablation and venous seal closure system. I'll also have a video for you to view.
And before 2016, there are at least 18 patients with arterial injury and 16 cases of stroke reported in the literature. However, comparing with the number of patients who receive sclerotherapy all over the world, the number of complications are relatively small. So don't be afraid of complications. In the next, I'm going to talk about complications from endovenous thermal ablation, including blister, skin burn. This usually develops in doctors who are not familiar with the procedure and used to too much energy and too less to method. The nerve injury, usually less than 1%. and usually temporary. Bruising and hematoma are common. Discoloration in some patients.
And thank you for your attention. I don't know if we have too much time for questions, but if there are any, we would like to entertain them at this time. Let me check the list. Does not seem that there are any questions at all. Terrific. Well, I want to thank all the speakers for taking their time on a weekend to share their insights. And this has been quite the educational experience for me. I hope all the attendees around the world as well. So this will conclude our session on office-based treatments for venous disease. And good night for all of you in Asia, and good morning to everybody out in the US. Thank you, Dr. Zhang.
Thank you.
Thank you, everyone.
Bye-bye.